I've had a lot of patients coming in basically asking me about it, and so I was approached also by a pharmacist to come down and look at this. I started reading about it online, and I think really that's what is really happening in this country at this time. In regards to how preventative medicine is practiced in this country, there is absolutely none. When people look at how medications are given by doctors, the simple basis of everything is just to keep people sick. As long as people stay sick, the drug companies will continue to make money, the insurance companies will continue to make money, the food industry will continue to make money, and believe it or not, doctors and hospitals will continue to make money. So when a postmenopausal patient comes to a doctor and says, "Doctor, I can't sleep, my sex life sucks, I've gained weight," what do? We run a bunch of labs that we really don't have any idea. We just go by a bunch of values which don't mean anything. And we give them a sleeping pill, we give them a Viagra in some cases, for females, I don't know, stuff like that. And does it really take care of what the basis is of these symptoms? No, it doesn't. And again, that goes back to keeping them sick as long as you can, so that these drug companies and so forth and so on make their money. And so what is happening, I think, now is that people that are a little bit older are going online, and thanks to Google and things like that, people can actually start reading these things now. So now the big pharmacies or these big drug companies can't continue to lie about what is going on. So people are well read, they come into their doctor and they say, "Listen, this makes sense, I want to do it, how can you help me?" And that's kind of what I did myself in regards to the Wiley protocol. And when you examine it, you don't have to be a doctor. It makes sense that all these diseases, both in men and women, start after all our hormones start going down. What age is that? 35, 40, 45, 50, whatever it may be. So restoring them in the same exact manner that they were when you were 20 years old would just absolutely make sense to me. And from what I've heard, there is a doctor close by and he has about 50 or 60 patients, and every single one is happy. Now, any kind of medicine where you got 100% of people happy, so to speak, then that's what I believe in. So that's from a colleague to colleague type of thing. T.S. Wiley has been very good in kind of just putting it step by step and explaining everything from, all the way from the planets all the way up to the hormones and their fluctuations and so forth, and symptoms. And so once I think I get a good handle on it, then I'll be better able to help my patients with that.
I've been aware of the Wiley protocol for 2.5 years now, and I've been prescribing it for just about that same amount of time. I heard about it from a patient, and when I heard about it, looked into it, and then decided to do the seminar and get educated about it, and immediately realized it was an answer to a lot of questions I had about the bioidentical therapy I was currently using, and found it to be very satisfying. I've been using it ever since, and almost exclusively if I can talk people into it. Sometimes where I was at when I started, it was a fire hose, so there was so much to learn that that the seminar was incredibly helpful to get started. And then as I had more clinical experience, I was able to utilize the pieces of information that I was getting from the seminar, and Susie keeps improving the seminar, so there's more information added, and again, those things are helpful as well. But it's really my ability to learn, and my place where I'm at in learning about it has improved as I'm practicing it. So I think that the more dramatic people are in their symptomatology when they come to me, the more dramatic the effects are, obviously, and the more immediate I seem to see effects. So I have anxiety and depression, bone loss, hot flashes, no libido, relationship issues. All those things seem to improve dramatically when I start people on the protocol. Anxiety and depression, I'm getting people off their medications. Osteoporosis, I'm seeing reversal. libido, sex drive, or libido and relationship issues seem to improve if that's what the patient wants, and I have exciting results in those areas. So I had patients, so men patients, but their partners were initially my patients, most of them. Some of them were initially patients who were begging for something. And finally the Wiley protocol came out earlier this year, and so just had so many folks that just glommed onto that. And what I found initially is that people had a beautiful response early on, and that just like with the women's protocol, you have to adjust dosing, and they're still having amazing responses. I've had two folks have complete clearing of a 10-year-long history of just severe eczema that surprised all of us, and that I expect to see more of that. So skin issues were better, their sex drive, their erectile function, all better. So I think they're all happy. They just I haven't been with my men patients long enough to get them adjusted to levels where they're going to stay at. So we're experimenting with the new 25 and 50% increases as opposed to the static line increases that I think are working even better. So.